Well, national dental care is officially here, a key tenet of the government's supply and confidence agreement with the NDP. The deal to create the Canadian Dental Care Plan was announced back in December. And according to government officials, 1.9 million seniors who are the first to qualify have already signed up. But here's the problem. Only a few thousand dentists reportedly are on board right now to take up the program, and immediately that puts into question the future success of national dental care. Joining us now is Dr. Joel Antel. He is the president of the Canadian Dental Association. Dr. Antel, thank you for joining us today.
Thanks for having me. I appreciate the opportunity.
So as we said, this is the first day of the National Dental Care Program. But, you know, even ahead of today, we've been watching this debate go back and forth between dentists and Ottawa. And, you know, I've read statements attributed to you in which you say dentists still don't have enough information from the government. What kind of information is still lacking here?
At this point, to take part in the program, dentists have to become party to a very long technical list of terms and conditions, some of which haven't been finalized, some of which haven't been clarified, and they really need that information before deciding.
So need that information before deciding, and is that for fear that they won't get paid or that they might end up spending hours and hours on administration?
The paying part is not the concern. It's the administrative burden that comes along with it, and the difficulty in when we're dealing with our patients of keeping the focus on the patient-dentist relationship and determining the correct patient treatment rather than getting into the terms and conditions as part of the treatment planning process.
Terms and conditions, as you say. And you know, it's interesting because I was reading this article that quoted the health minister, Mark Holland, and he said for dentists who have concern that the process, the administration might become too onerous, he encourages them to at least try with one patient to identify any issues they may or may not have. What do you make of that suggestion?
The issue isn't the difficulty of signing up. We're all computerized. It's very easy to do. The concern is that they asked us to sign on to a contract that is open-ended with parts that haven't been finalized and the government having the right to change the contract at any time without them having committed to negotiating or discussing it with us first. They've come up with an alternative pathway for taking place, which is this process of just sending in a claim. What dentists have to understand is that when you send in that claim, that is accepting all the terms and conditions that you would have accepted had you signed the contract. So it's just another path to the same end, not a different pathway.
Do you think the government's not being forthright enough with dentists?
We've been working with the government almost from the beginning of this to try and help their program be the best program it can for Canadian patients. And our conversations have been very civil and very productive. We haven't always been in agreement. I would not want to characterize the government as being at odds with us. We just have a long way to go yet before we can make this thing totally workable the way it has to be. So it works for government, it benefits patients that come into dental offices, and it's sustainable in dental offices.
Now, you have, and your association has, raised concerns about patients under a public program also not really understanding what they're actually eligible to receive. Do you see that as a government failure to properly inform Canadians about what this program will or will not cover before rolling it out?
I think the public messaging could be better because people are walking into our offices very uninformed, and most dentists are already, even though they're not participating in the program, they're still having onerous conversations with many, many patients where dentists or dental office staff are being taken away from patient care to have to explain to the patients the misconceptions that they've heard. The government has done a very good job of putting the correct information on the government website where if someone knows it's there and goes looking for it, they can find it. But the public messaging that the people hear through active media, the radio, the TV, that messaging could be a lot clearer and a lot more accurate.
Mm-hmm. Now, I'm wondering what type of timeline do you think this is going to take? Because as we said right off top, 1.9 million Canadians have already signed up, and that's just the first cohort. So when you think of only a few thousand dentists now involved in the program, what type of wait time is there going to be for people to actually receive national dental care, do you think?
Unfortunately, it's not going to be a wait time as much as it's going to be a very difficult process to find someone who's actually working in the program. And if someone already has a dentist of record, they may have to change dentists because they won't have their choice of dentist. They'll have to change to somebody who is participating in the program. For timeline, I'm very hopeful that we can wrap this up very quickly. Certainly, the closer the government makes this so that their program is like private dental insurance, the faster we can wrap this up. I don't think we're looking long term. Maybe I'm being overly optimistic, but I hope that's how it's going to play out.
So at the end of the day, you think national dental care will be a success?
I think it's going to be with us for a very long time. How big an impact it has is how good the program becomes after all the tinkering is done.
Dr. Joel Antel, I appreciate the time and you taking it away from your patients to have a conversation with us this evening. Thank you for this.
Thanks for having me. I appreciate that.